Hey guys, this is Dr. Samir Islam, and today I want to thank you for joining me on my Facebook Live. And today we're going to talk about hemorrhoids, and I know it's everyone's favorite topic to talk about. I know it's a topic that I get a lot of questions about, and there's a lot of people there who may have hemorrhoid issues but not be realizing that it could be what's going on. So for these next couple of talks, I'll be discussing about hemorrhoids, what they are, how we diagnose them, what symptoms that you may have, and how do we actually treat them. So if you are maybe too embarrassed to speak to your healthcare provider about those hemorrhoids, well, feel free to ask any questions you may have, and hopefully I can answer those questions. But let's begin. So hemorrhoids, they are actually swollen veins within the rectum or the bottom, and in some cases you can actually feel or see them, especially if they go on the outside of the rectum. In other cases, though, you cannot actually see them because they're on the inside. They're called internal hemorrhoids. So internal hemorrhoids are hemorrhoids or dilated veins that are inside the rectum. They're very difficult to see, but they do cause symptoms in a lot of people, including pain and bleeding and itching. The other hemorrhoids that people typically worry about are the external hemorrhoids. These are the ones that typically you can see. They're outside the rectum. And other ones that a lot of people can see when people feel like they have hemorrhoids, they feel like it's actually their internal hemorrhoids that are causing them the issues, where most of the time, most symptoms come from internal hemorrhoids, and external hemorrhoids just don't look very good, but they very rarely cause symptoms. So most of the symptoms that you have are from hemorrhoids that you may not actually know that you have, but those are typically the internal hemorrhoids that are seen there. Now, hemorrhoids are very common. They occur in both men and in women. And although hemorrhoids don't cause serious health problems, they can be very annoying and very uncomfortable to have. There's a lot of pain, itching, pressure, bleeding associated with hemorrhoids. That can be very troublesome for a lot of people who have hemorrhoid issues. Now, the good thing about hemorrhoids, if there's anything good about them at all, is that there are very effective treatments to take care of hemorrhoids, both over the counter and that we can do to help take care of those hemorrhoids to get rid of them permanently. And over these next couple of lectures, I'll be discussing about what those treatments are. And so even though hemorrhoids are very annoying to have, they're not fun, they are all very treatable. And for a lot of our patients, we can effectively cure them of their hemorrhoid problems. And so the way we diagnose our hemorrhoids, sometimes we can just do a physical exam. We can actually feel the hemorrhoids when we do a physical exam. But in other cases, we can't see them until we actually look inside. And there are a couple of different ways that we can do that. One is certainly with a colonoscopy, where we can actually see if you have hemorrhoids that are there. Another option is a flexible sigmoidoscopy, which is a smaller scope that we use to take a look at those hemorrhoids as well. Then lastly is an anoscope, in which we actually, it's a very small little scope that we actually have in the office that we can take a look and see. And through these mechanisms, we can let you know what type of hemorrhoids you have, how bad they are, and what options we can do for treatment, because there are some hemorrhoids in which we can't fix medically, and that might need surgical treatment, whereas there are other hemorrhoids in which we can cure medically and hopefully get rid of them so you don't have any more symptoms from that. So in summary, hemorrhoids are dilated veins within the rectum. You have two main types, both internal hemorrhoids and external hemorrhoids, and they can cause various symptoms depending on how big they are and where they're located at. And a lot of the symptoms also depend on the location of those hemorrhoids, whether they're inside the rectum, whether they're on the outside of the rectum, whether they're very large, or whether they're very small.